Okay. Hi, I'm Shelby. I'm going to be your nurse today. Can you verify your name and date of birth for me? Okay. I'm going to verify the physician's orders, provide privacy for the patient, and explain to them why we are going to be suctioning, answer any questions that they have, and make sure to obtain verbal consent. I'm going to raise the bed to the level of the hips and place the patient in a semi-Fowler's or Fowler's position. Before we start, we want to auscultate the lung sounds. We want to increase the supplemental oxygen flow, making sure to follow the facility's policy for hyperoxygenation protocol. I'm washing my hands, so I make sure to put on my PPE, put on my mask and eyewear. I'm going to prepare my supplies, so I have my suction kit right here. So I'm going to prepare my suction kit. I'm going to pour sterile saline into a basin. I'm going to put on my sterile gloves. So I'm just going to verbalize I would put on my sterile gloves at this point. I'm going to take out with my sterile gloves on, I'm going to take the catheter and I'm going to coil it in my hand, in my dominant hand. And then with my non-dominant hand, I'm going to turn on the suction device and adjust it to 100 to 120 millimeters of mercury for an adult. And then I'm going to turn it on. I'm going to pick up the suction tubing and connect it to the suction catheter. I'm then going to dip the tip of the catheter into the basin to flush and moisten it to make it easier to insert. With my non-dominant hand, I'm going to remove the trach mask. With my dominant hand, I'm going to insert the suction catheter into the tracheostomy until resistance is met or the patient coughs. So I'm going to put this in there until either resistance is met or the patient coughs. I'm going to withdraw it about a half of an inch and then apply suction intermittently and gently rotate the catheter while withdrawing it and making sure that each suction is no longer than 10 to 15 seconds. I'm going to rinse the catheter and the tubing using the sterile saline in my basin that's next to me. And then I would repeat those steps for a total of 2 suction passes. And then you will disconnect the suction and the catheter from the tubing, discard the catheter and supplies. And then for the Trach Care portion, we would make sure to remove the dressing and discard. At this point, we would assess for color, consistency, odor, and amount. Make sure all the supplies, the suction equipment, and my old gloves are thrown into the trash. I'm washing my hands. And then I'm going to get my tracheostomy care kit. And I'm going to put it on the bedside, right on the table next to the bed. And then I'm going to don one of my sterile gloves on my dominant hand. And then with my non-dominant hand, I'm going to pour the saline into the sterile basin. And then I will put my sterile glove on the other hand. I'm going to pre-moisten these cotton-tipped applicators for cleaning. I'm going to insert a new inner cannula into the trach, and then I'm going to make sure I follow the direction of the curvature and secure it by just turning it to a locked position. And then with the cotton-tipped applicator, I'm going to clean the outer cannula and the trach using a circular motion from the stoma site and moving outward. I'm going to stabilize the trach tube with my non-dominant hand, and I'm going to, while I'm stabilizing that, I'm going to place this fenestrated dressing underneath the phalanges of the outer cannula. And then I'm going to replace the ties, one one side at a time through the eye of the flange while keeping the old ties in place until the new ties are securely fastened using a square knot. And then I'm going to discard of the old ties, all my supplies, take off my gloves. I'm going to wash my hands. I'm going to also take lung sounds again, return oxygen to the prescribed amount, wash my hands, and then make sure the side rail is up, the bed is locked in the lowest position, and call light is within reach, and I'm washing my hands.